Hi, my name is Dr. Melissa Carr, and I'm a doctor of traditional Chinese medicine in Vancouver, BC. Today I'm going to talk about digestive health. So whether you suffer from a digestive illness or disorder, or just the occasional issue with your digestion, or whether you are just looking for a way to improve your digestion, these are some tips that you can do. Your digestion is key to your overall good health, so I do recommend these things for everybody to do. And because nutrition is really key to how your digestive system functions, what you eat matters to how your digestion feels. I definitely recommend that you eat healthy foods and seek help if you have any digestive issues. I treat a lot of my patients with nutritional recommendations, even if they don't have particular digestive disorders, so I make recommendations for food, even for things like low back pain or whatever it is, because I do think the importance of digestion and what we eat is so essentially important. But today I'm going to focus on some more general tips. So my first and most important piece of information to tell people to improve their digestive health is to chew their food well. Too many times we eat too quickly and we don't chew our food super well, so people even who tell me that they can't swallow any capsules or tablets or pills, they're swallowing down huge chunks of food without chewing it, without even thinking about it. When we chew our food, we're starting the digestive process there. So the actual action of breaking down the food with the teeth is really important. Chewing also is important for our teeth, as well as for the functions of our muscles within our face too. Even chewing foods that are soft. So I chew my oatmeal in the morning, even though I don't need to, because it slows down the process at which I'm eating, and it also mixes the saliva with the food, which helps with the breakdown of some of the starches. Second thing is mindfulness practice. So while you're chewing, paying attention to the food, the flavor, the texture. Does it remind you of any particular feeling, experience, memory? Sometimes food is tied in with memories or comfort. So I even recommend that people, especially if you're eating a food that isn't particularly healthy for you, but you're enjoying a piece of birthday cake or something like that, to really experience the food. So to enjoy it, my husband always says that he only needs one bite of a good food, sometimes two. So the best bite is the first bite. So that is when you're like, oh wow, this is a really good flavor. I'm going to be paying a particular attention to that first bite of something delicious. The second bite isn't quite as good as the first, and the third bite's not quite as good as the second. And the second best bite is the last bite, because you know it's the last bite. So I don't practice the only 2 bites of birthday cake. I personally will eat the whole piece of cake, but I'm going to make sure that I enjoy it and that I am savoring every bit of it. And that can be done with foods even that we don't enjoy. We can look for things that we do like about it. Like maybe I don't like the flavor as much, but I like the texture, or I like the fact that it's nutritious for me, and I know I'm doing my body good service. Mindfulness is really important to how we eat as well. Next tip is things that you can do with self-massage and acupressure. So I'm going to move this down here so I can show you some things that you can do to improve your digestion. So one is to practice massage around the abdomen. And so what I'm doing is I'm applying pressure with my hand around the belly button. So I'll show you that I'm going a little bit below the rib cage. I'm going under the rib cage. I'm going to the left side down of the belly button, going across the lower abdomen, going up the right side of the abdomen, and then across the middle. And when I was applying pressure, I was using the palm of my hand and applying that with pressure enough that I can feel that it's got a little pressure. I'm using my second hand to add a little support to that pressure, a little bit more. And the pressure should be that I feel that I can massage it. So it's not so light that I can't feel it moving, and it's not so heavy that it causes me discomfort or pain. So you might have to change your level of pressure depending on how much you ate or what your digestive system is like. So doing that around for a couple of minutes is helpful. And when you're doing that, you can also add stopping at certain points. So that first point there below the rib cage, so again, the palm of my hand, I'm going to apply pressure on underneath the rib cage there, and I'm just going to hold that and breathe into it. When I did the massage, so ideally you want to do that massage there for at least a couple of minutes, and you should feel the abdomen being quite warm, so that when I apply my pressure on this point here, it's already warmed up, and now what I can do is just breathe into it. So I want to take at least 10 slow, deep breaths into this spot here. The next spot is the left of the belly button, so belly button a little to the left of that, and I'm going to apply. You might even find that the area is a little bit tender when you apply pressure with your fingertips, and you can apply that same pressure there. And again, 10 slow, deep breaths. And you're going from the center, down on the left, then you're going below the belly button, a hand width below the belly button, and again, holding that and breathing. You can also do this seated. Sometimes it might be more comfortable to be seated for this than standing. It's up to you. And then the next one is on the right side of the abdomen. Same spot as on the left side, just the mirror image of it, and apply pressure and breathe in. So 10 to 15 breaths per each pressure point and a couple of minutes of the initial massage. Next points I'm going to show you are some points for acupressure specific. So these are points that you might have had if you've had acupuncture. So this is, I'm going to lower this down here because I'm going to show them on the legs. So this is on the lower leg on the shin. So I'm going to find the area at the knee that's got a little bit of a divot. So you can feel a divot on either side of this patellar tendon. So there's the kneecap, right through there. There's the patellar tendon. There's a divot on either side, and I'm going to hold that divot there with one hand, put the other hand down here. I'm using a full hand width. I'm going to feel the shin bone here. This is the pointy, this is the edge of the shin bone, this is the main area, the highest edge of the shin bone, and this is just off the side of it. So I'm going from that place here with the divot. I'm going to go one hand width down, and I'm going to find this spot here. Okay, so this spot here is stomach 36, and if I press it, I may find it's a little tender if I apply enough pressure to it. It'll be particularly tender if it's a good spot for me, but sometimes it's usually a spot that is a little bit of tender, and if you don't find it there, try moving around up and down a little bit, a little to the side, but you're off the bone, so don't press on the bone. Okay, and then I can do the same thing on the other side. I happen to know where that point is, but again, you're going to go from the point where you've got that little hole, that little divot in the knee, one hand width down. So your hand width is here, one hand width down, and apply pressure. Of course, I know exactly where it is, so I don't have to measure it out. And you can do acupressure with your thumbs, a finger. You can use a tool like a pencil or something like that. You want it to be a little bit tender, but not too painful. You're not trying to bruise yourself. And do little massage there. So you can massage circular motions, little circular motions. You can apply pressure, pushing in, release, in, release, or you can just hold steady. For a lot of people, holding that steady would be tiring for the hands, so I recommend some sort of movement. You can do one at a time if that feels like too much. If you can't reach that way, you can put your leg up in order to be able to apply pressure. Or you can use a stool underneath your foot if you want to bring your leg up and comfortably rest it. Whatever works. The next point I'm going to show you, there's a bunch of points along, well, that was stomach 36 by the way. There's a bunch of points along the spleen channel that are helpful for digestion here. So the starting point, I'm going to start closer to the toes. You've got the big toe, you've got the bone of the big toe here. You're going to feel the bump, and then you're going to feel just to your side, so closer to your heel, just on this side, you're going to feel a little area of tenderness, and it's in a fleshy spot. There's a little tender spot there. So that's spleen 3. That's a great point to apply pressure to. And if you want, you can just do little circular movements and follow along just under the ridge of the bone. Some of the points are acupuncture points. So I hit spleen 4 here. Some of the points are not, they're just along the channel. Okay, so just, you can do a little massage there if you want to as well. So it might feel really nice to do that anyways for your feet. Our poor feet get to so much work over our day. The next point I'm going to show you is spleen 6. So find the tip of the ankle bone. This is called the medial malleolus. So the tip of the inside ankle bone. I'm going to put my hand there. So I've got, there's the tip, there's my hand, and I'm going to go just above the hand again, just behind the shin bone. And this one, for most people, will be a little tender. And again, I can apply pressure there. If you want to, you can bend down and get both of them at the same time, or you can do one at a time. This point has many functions, and it's a crossing point of 3 different channels, so it has a lot of different uses. It's called spleen 6, Sanyan Jiao, 3 crossing point. But it is a crossing point for spleen, kidney, and liver, so it has a lot of functions. For women right before your period, this might be even more tender than at other times. So those are some of the things that you can do on the leg. There's an large intestine channel through the arm. So if you have intestinal issues, you might consider intestinal pain. You might consider large intestine 4, which is on the back of the hand between the index finger and the thumb. Find a tender spot there. Large intestine 4 is usually a good tender spot. It's also good for pain in general, as well as issues with the head and face. So headaches, particularly forehead headaches, eye pain, tooth pain, mouth pain, jaw pain, or issues on the head and face. Another way to find it is to use the ridge of the crease of your thumb, where your thumb bends, and then the web of your hand, and have those two meet, and then just roll the thumb down, and you'll land on the spot. Large intestine 4 is a very useful point. Large intestine 11 is at the elbow. So see where I bend my elbow? You might see where the crease ends. That's where the point is. So again, find a spot there. Then you can just rest your arm and apply pressure there. With these pressure points, they should be tender. You should be massaging them until they're a little bit tender as well, but not to the point of pain, not to the point where you're bruising yourself, just to the point where you find you can feel it getting warm and you can feel sensation. I hope that helps with some basic digestion tips. Let me know if you have any questions, and I hope you enjoy your next meal. Thanks.